The White House just saw a coronavirus outbreak and cases are rising in some states. Joining me now is Dr. COLBY Grossman, the president and founder of Palmetto Clinical Research. Dr. COLBY, we were having a conversation the other day. I said, Trump back out on the campaign trail. What do you think? What do you think?
So I think he did a good job. I mean, basically, I'll give you one quick analogy. So you got a little teeny fire behind a house, okay? It's like 2 feet across. So the neighbor calls about 5 fire trucks. They're outside, and he looks from the back side of the house, and there's just a little campfire. But from the front side, it looks like, you've got this huge fire. So the question is how sick was Donald Trump? So there's a CDC severity criteria listing 1, 2, 3, and 4, mild, moderate, and severe. Okay, so critical is a person in the ICU. Severe, they're in the hospital. Maybe they have a pretty bad pneumonia, but they're not in the ICU. And then mild to moderate patients usually either are in the hospital or aren't even in the hospital, to be perfectly honest with you. So what did Donald Trump have and what did he get? Well, first of all, he got Regeneron, dexamethasone, and oxygen. So those things are like the fire truck in front of the house. I mean, it looks like there's a big fire because you don't give Regeneron, dexamethasone, and oxygen unless people have either severe or critical illness. It just doesn't happen. The only people who do get that are people like Donald Trump. So I think he had mild disease and maybe at the most moderate. Did he have pneumonia? Well, probably. He probably had pneumonia. They never came out and said he didn't have pneumonia, but let's face it, I never heard him cough, and I didn't really hear him cough after he got out of the hospital. So I personally think that he had mild or moderate disease. And why does it matter? Well, it matters because it depends on how long you quarantine somebody after they get out of the hospital. If they have moderate or severe disease, the quarantine is 20 days. If they have mild or moderate disease, the quarantine is 10 days. So he followed the criteria specifically based on mild or moderate criteria. And on top of that, he went and did testing. He tested every day until he had 2 negative tests. So I think he did everything humanly possible. They also gave him grief about going back to the White House. That's where he lives. I mean, that's his house. He didn't go to the Pentagon or the Senate. So I think he did follow the criteria exactly as the CDC would want.
I got 30 seconds left, COLBY. So I'm going to be sitting with the president, which will end up being 14 days after we know he was tested positive. Am I at risk?
You are not. He has had 2 negative tests. He's been outside the window based on the CDC, and you are at no risk. Matter of fact, you're probably at less risk than you were 3 weeks ago. Matter of fact, I know you are.
Well, Larry, we're going to leave it right there because there are people who are saying, hey, Bolling, if you go to that interview, don't come back to this studio. I'm like, guys, I'm coming back. I'm going to see you. COLBY, I'm going to see you. Full disclosure, COLBY's my doctor. Dr. COLBY Grossman, thank you for your time.
Have a good day, Eric.